Now, one of the most critical factors in being able to end these devastating restrictions is getting a cure or a treatment or a vaccination. There are now trials of various treatments already in the market for other particular diseases, particularly an anti-malarial drug called chloroquine or hydroxychloroquine, in combination with another drug particularly. I last week told you about one trial by Melbourne's Walter and Eliza Hall Institute that will start in about 3 weeks with 2,200 health workers. That's to see if hydroxychloroquine can actually stop you getting the virus in the first place. But now there's another massive trial about to start even sooner, also in Melbourne, thanks to the Doherty Institute and big donations, particularly from 3 billionaires, Australia's Anthony Pratt and Clive Palmer, and China's Jack Ma. Yes, China's Jack Ma. And it's a trial that should cover every single person who goes to hospital with this virus. Joining me earlier was the Doherty Institute's director, Sharon Lewis. Sharon Lewin, thank you so much indeed for your time. Can you tell us about your trial? What exactly are you going to do?
The trial is a treatment for people that are unwell with COVID-19 and are in hospital, and it's aimed at stopping the virus in its tracks so that people don't die or need to go to intensive care, and that would make a huge difference in the burden on our healthcare system.
Okay, so who are you going to test first? Who are you going to hand out the drugs to in the initial phase, and to how many?
So this particular trial is called Escott. It will be rolled out to 60 different sites across Australia and enrol over 2,400 people who have COVID-19 and are sick enough to be in hospital. Only about 20% of people with COVID-19 will end up in hospital. And the study will look at 2 different drugs, and it will compare what we call standard of care, which is what we would normally do without any antivirals. One of the drugs, which is usually used to treat HIV, another drug that is usually used to treat arthritis, or the 2 drugs together. And we'll randomly allocate people as they come into hospital to each of those 4 arms of the study.
One of those drugs is hydroxychloroquine, is it?
Yeah, exactly right. Yes, used to treat forms of arthritis.
Isn't this amazing how hydroxychloroquine or chloroquine, they've both been initially suggested and dismissed as crank ideas. Now there's trials in many countries, and this is probably one of the most widespread. So it's terrific. How optimistic are you that you will find something that works?
Well, first of all, I don't think chloroquine and hydroxychloroquine were crank ideas. They both look pretty good in test tube models in stopping the virus in its tracks. And we've known that for a while. The big challenge is to know whether these drugs actually improve clinical outcomes, meaning reduce deaths or stop people going to intensive care. You may stop the virus in its tracks, but does it actually lead into an important outcome? And you can only answer that question with a large and what we call randomised trial. And the trials so far have been small. They look pretty good, but they're small, and they just look at the effect on the virus, not the effect on the person. And that's why you need these bigger studies to really know if you've got a winner or you've got a drug that you really shouldn't be worrying about using.
You're right to pull me up on the word crank. I should have made myself clearer that it was the media that was laughing at the mavericks who first were raising this, like the French doctor, and also laughing particularly harder when Donald Trump started promoting. But when do you expect any initial signs that this might be working? How long do you think we have to wait before you can at least get optimistic?
Well, we're ready to go actually on Monday with opening this trial.
Wow. That's incredible. How'd you get it that fast? That's incredible.
Because we've been working away at it for a long time. Actually, my colleague, Stephen Tong at the Doherty Institute, has had this idea from probably early February. Engaged 60 investigators across the country in part of a really big national effort together with New Zealand. Ideally, we'll complete the trial, enrol 2,400 people, and do that quite quickly.
Well, it's basically anyone that's going to be sick and in hospital is going to be part of this trial. I mean, this is astonishing. Look, I know it's early days, Sharon, Lewin, and I shouldn't be excited, but this does sound exciting. Can you tell me, I would have thought that governments would have been banging down your doors, throwing millions at you to save us from this virus. It's actually, just killing people, but obviously really devastating a lot of people's lifestyles. It's amazing, but we should be grateful that billionaires like Jack Ma in China and Anthony Pratt in Australia have come forward and helped you with critical money, $3 million in total. How helpful is that?
It's really helpful, mainly because of the speed at which we can do things. I mean, the government has been incredibly supportive of research in all areas, including COVID-19, but the whole process just takes a bit more time. There currently is a competitive process for money from the government exactly for clinical trials. We'll be competing for that as well. But that process takes really weeks to months until you know that you've secured the funds and then can get going. With a philanthropic gift like the $1 million from Anthony Pratt, I mean, it allows us to get moving straight away. Our colleagues in Brisbane have also been successfully fundraising for this under the leadership of David Patterson. Clive Palmer has also given money to the group up in Brisbane. We're all part of the one trial, of course, but philanthropy allows us to go much quicker. And in other settings, philanthropy also allows us to try something that might be a little bit more experimental and less proven. Not in this case, I think, but.
Well, Sharon, I brought you on because you're the medical genius. I'll leave the political remarks to myself about what that says about the speed of government, and thank God for capitalism and philanthropists, and a big tick to Anthony Pratt and Clive Palmer and Jack Ma. But Sharon, Lewin, look, the nation will be looking with eagle eye on what you're doing, and I thank you so much for the initiative that you and your team have shown, and all the best to you.